Welcome back to the Best PT Podcast. This is episode 17.2 talking about deep thermotherapy. So deep thermotherapy heats 3 to 5 centimeters beneath the skin. The most common type is ultrasound, which produces thermal and non-thermal effects. Thermal effects include increased metabolic rate, reduced muscle spasms, decreased joint stiffness, improved nerve conduction velocity, increased circulation, improved soft tissue flexibility. Non-thermal effects: increased cell membrane permeability, increased intracellular calcium levels, and increased healing rates. Indications: calcium deposits, chronic inflammation, dermal ulcers, joint contractures, muscle spasms, trigger points, pain, plantar warts, scars, and the need for improved healing. Contraindications: active bleeding, decreased sensation, decreased circulation, DVTs, infection, malignancy, breast implants, epiphyseal growth plates in children, using ultrasound over the eyes, heart, genitals, carotid sinus, or spine, pregnancy, so anything to deal with treatment areas over the uterus, a cardiac pacemaker, or vascular insufficiency. Parameters: frequency: use a 1 megahertz frequency to reach deep tissues and a 3 megahertz frequency to reach superficial tissues. Duty cycle: continuous duty cycle produces thermal effects, while pulsed duty cycle produces non-thermal effects. Duration: takes approximately 5 minutes to heat an area twice the size of the transducer head. And then number of treatments: 2 to 3 sessions per week is recommended, with positive results being seen within 3 treatment sessions. And research has shown that more than 14 ultrasound treatments and a short episode of care can reduce red and white blood cell counts. Phonophoresis is the use of ultrasound to deliver transdermal medication. Indications: bursitis, inflammation, degenerative joint disease, increased metabolism, joint stiffness, muscle guarding, trigger points, pain, and tissue healing. Contraindications: acute infections, inflammation, pacemaker, hemophilia, body metal, so any sort of surgical implanted metal, IUDs, pregnancy, any treatment area over or around the uterus, malignancies, moist wound dressings, the use of phonophoresis over the eyes or the testicles, and sensation deficits. And finally, diathermy. Indications: bursitis, inflammation, degenerative joint disease, increased metabolism, joint stiffness, muscle guarding, trigger points, pain, and tissue healing. Contraindications: acute infections and inflammation, pacemakers, hemophilia, implanted surgical body metal, IUDs, pregnancy, any treatment in or around the uterus, malignancies, moist wound dressings, over the eyes or testicles, and sensation deficits. Parameters: shortwave diathermy operates at a frequency of 27.12 megahertz. 20 minutes of treatment for thermal effects, and 30 to 60 minutes for non-thermal effects. Capacitive plates should be used for superficial effects, and inductive coils should be used for deep effects. That's it for episode 17.2, talking about deep thermotherapy. Episode 18 will talk about cryotherapy modalities. As always, the outline will be in the show notes. Thanks for joining.